Call it Pop Bubba Sparks.
Booty, 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 rockin' everywhere. Booty, booty.
Hey, I don't know what to do.
What's up, YouTube? It's Desi and I'm back with another video. And first, before I get started, y'all, I know y'all love my hairstyle. It's my girl Nay, y'all. She did her thing, y'all. Zigzag in the back, zigzag in the back. Y'all see me. You know the MA gotta show off when she looking good. Alright, so y'all, first things first, I know many of y'all are going to ask as far as for where did I get my scrub holder thingy from. So I got this from Bath & Body Works. I've been getting a lot of compliments from this. They have a sale going on actually. These are actually like $12. And with the coupon, you can actually get it 20% off. But I use it for my hand sanitizer opener. So that's basically what that's for. They have the pink ones out for Valentine's Day. I love this one because this one is for first care responders. So calling all heroes. And yeah, so that's for my badge for medical assistant. All right, so this video is going to talk about as far as for the most rated healthcare medical assistant specialties to get started off with for 2021. I had already did a previous video where I talk about for 2020 the top 10. So this will be the top 15 for you guys. Hopefully this can be able to kind of let you know as far as for where to start off working at. I currently work as a medical assistant for pain management. You guys know all about my videos. If you don't know, check the links down below and I'll be able to help you out. Before I get started with this video, don't forget to like, comment, and subscribe. I always check everything, and don't forget to hit that notification button, you guys. So just make sure you hit that bell. All right, so the first things first, I'm gonna start off with is cardiology. So this is gonna be the specialty that deals with heart, anything dealing with the heart. So basically, cardiology is this medical specialty that diagnoses and treats patients with diseases and abnormal heart, rhythms or whatnot, or anything dealing with blood vessels. As a medical assistant, you'll help assist with phlebotomy, cardiac imaging, EKG or ECG, and cardiac stress tests while being supervised by the physician. I love the fact that you'll be able to work underneath a physician when dealing with medical assistant working. Like I say, if you guys looking to work underneath a nurse, definitely consider working as a CNA. That'll be a certified nursing assistant, but medical assistants usually work with physicians, so that's something to keep in mind. To prepare for the patient, basically the medical assistant will help assist with exams by the physician. They'll also help as far as for recording vital signs, making sure that they take the blood pressure and whatnot. The medical assistant will verify the patient's medication and get a brief history as far as for risk factors or anything like that. So the first one is going to be cardiology. So if you're good as far as for anything dealing with the heart, or if you just want to get interested into the heart, cardiology will be something good for you. The second one is going to be dermatology. Anytime you hear the word dermatology or anything that deals with the skin, make sure you keep that in mind. That will be on your test for medical assisting. So dermatology is the medical specialty that is concerned with the diagnosis and treatments of skin, nails, and hair diseases and disorders. The medical assistant job is to basically be responsible for assembling, cleaning, and disinfecting the medical instruments that the physician will need to perform diagnostics procedures. So anything that's dealing with the skin, if they need to like cut back some of the skin, pull back some of the skin or anything like that, the medical assistant will be able to help assist as far as for that. If that's something that I will get into, dermatology, I would definitely say no. It's a lot of stuff as far as for the skin that I don't want to see. So I definitely feel like if you're interested into that, this will be perfect for you. If you look at any type of like disease or any type of like condition or anything, and it shows you a picture or image on Google, it looks so like terrifying, or sometimes it just looks so crazy. It's like, oh my gosh, I wouldn't even want to get into that field. But if you're interested into that field, I would definitely say give it a try out. Dermatology, I haven't heard many medical assistants get into that field, but I do see a lot of job openings on that with Indeed, so definitely check that out. I do apologize if I'm talking too fast, you guys. I know sometimes I talk too fast. It's just when I have a lot of information I have to tell you guys, it just naturally comes. So if you could probably just slow the video down or just rewind. All right, so the third one is going to be endocrinology. So basically, whenever you hear this specialty, it deals with diagnostics and treats of patients with diseases and disorders of the endocrine system. This basically includes the glands and hormones. So basically, the medical assistant would help assist and schedule, prepare, and educate patients about common diseases, procedures to identify problems related to the functioning of the endocrine system. Common tests that the medical assistant will be able to help out with will include the thyroid function test and also blood level testing. This one is a rare specialty I've seen many medical assistants into, so I'm not going to go too in depth into this one, but if this is something you're looking into, definitely look it up. I'll leave everything down below so you guys can kind of like follow along with me. Alright, so the fourth one is going to be gastroenterology. So whenever you're hearing anything as far as for this specialty is anything dealing with disorders of the stomach and intestines. Common tests that medical assistants will help assist with this specialty will be phlebotomy, ultrasound, stool tests, and also endoscopies. The medical assistant will help the physician as far as for diagnostics procedures to help examine the GI tract. The medical assistant will also comply as far as for the record of the patient's symptoms, history, and occupation, family history, trying to see if they're a smoker or drinker, just try to get their daily information, just to try to see as far as for what exactly the physician can do as far as for them. The medical assistant will also check for signs of heartburns, GI bleeding, weight loss, weight gains, history of alcohol use, like I said, just the basics to kind of understand as far as for what the doctor will need to do for them. Again, this is a rare specialty, and whenever I say it's a rare specialty, I don't want you guys trying to think like, oh, I don't want to work in that specialty. You just never know. So I would say try to look into it a little bit more to see as far as for that. Me personally, I never really worked into that field, so I wouldn't really know. All right, so the fifth one for you is going to be neurology. So neurology is a medical specialty that treats patients with abnormal of the nerve system. So this is anything dealing with the brain, spinal cord, or nerve systems. The medical assistant will be able to help assist as far as for examining the patient's nervous system. The physician will diagnose disorders based on the mental status and orientation as far as for the assessment for the brain. So they'll also check as far as for a sensory and motion function test, and just try to get a good understanding of certain tests to try to see how the patient is, how they function, or how their brain works and everything like that. This is anything dealing with the brain. So if I were you, I would definitely check into this. I'm really into science, so I had never really worked into this specialty, but at the same time, I would probably look into something like this because at the end of the day, it's different. So I definitely would give it a thumbs up. All right, the sixth one, this is the best one, y'all. OBGYN. Y'all already know OBGYN. So basically, this specialty works with anything dealing with pregnancy, childbirth, or postpartum period. This is pretty much combined with gynecology. So this will be as far as for a physician whenever they deal with obstetrics and gynecology, it comes together OBGYN. Now I may be saying that wrong. That's why I always just say OBGYN. OBGYN is one of the best, you guys. This is like the top number one. This is what I first started off with medical assistant, so I definitely recommend OBGYN to everyone. I feel like every female medical assistant should get their experience with OBGYN. It's like life-changing, and it's like you build that connection with the not only the patient but also the birth of the patient child as well too. So I feel like that's really awesome as well too. So definitely do check that out. Most of the stuff you'll assist with as far as for medical assisting when it comes to OBGYN will be pap smears, ultrasounds, making sure you get plenty of experience with blood work, also making sure that you help out with examinations for the physician as well too, and you'll just be able to help assist as far as for the mother-to-be patient. So I would definitely check out OBGYN. That's definitely number one. The seventh one is going to be oncology. Now this one I wouldn't really get into because I feel like this is a sad department. I wouldn't want to come home every day after knowing I like have to tell someone that they're like on their last breath or whatnot. But oncology is basically the specialty that deals with patients with cancer. Medical assistants will be able to assist oncologists and registered nurse with phlebotomy, patient check-in, scheduling appointments, billing and claim processing, vital signs, and chemotherapy and radiation treatments. We do have a lot of patients that's with pain management that has a lot of radiation treatments and whatnot, and it's so sad, you guys. So I would definitely say if you're really into this field, it's definitely something to get into. I know Baptists have a big old cancer development, so I would definitely check that into that, and also St. Vincent's as well too. So it's really a good specialty. Number 8 is going to be orthopedic. So whenever we're hearing orthopedics, that's anything dealing with as far as for the bones. We have a lot of patients that have to go to orthopedics doctors to see as far as for any type of injury they may have had or whatnot, and try to see what's the next step for them. So with that being said, orthopedics is a medical specialty that focuses on the correction of patients' bones and muscles. Some orthopedic specialists may focus on sports related injuries as well too. Medical assistants may assist the physician in the performance of diagnostic procedures, including assessments of structure and function and pain and movement. They will also interview the patients to better understand the events that occurred, circumstances that was led to, and also patients seeking medical help for their bones and muscles. So I would definitely check into orthopedics if that's something you're looking to get into. The 9th one is going to be pediatric. I haven't had my experience with pediatric, but I know every medical assistant will love this. This is anything working with kids. Pediatric is the specialty that involves the care of children up to the age of 18. A successful pediatric medical assistant will like children and be able to talk to them on their level. The medical assistant will be able to work with the pediatrician to monitor a child's development. Also, medical assistants will be able to take the vital signs, also assist with examinations, just the same thing you'll do on an everyday job, except you'll just be working with kids at the time. So I definitely feel like this is a good experience as well too. You also have plastic surgery. Plastic surgery is basically the type that's going to employ medical assistants to support them in the reconstruction, correction, or improvement of the body structures. So they'll be able to pretty much help assist with certain things, but it'll be limited to, because at the end of the day, you are working with a surgeon who will be able to take care of everything. But this will be a good field to get into because you'll know a lot bit more as far as for the body. The medical assistants will be able to assist in minor procedures, cleaning and disinfecting medical instruments, maintaining workstation, checking in patients, scheduling appointments, and billing processing. All right. We also have urology. Urology is going to be the medical specialist that diagnoses and treats the disease and disorders of the male and female urinary tract and male reproductive organs. The medical assistants will be able to assist the physician with urinary systems, also diagnostic testings with urologists, also phlebotomy, ultrasounds, and vasectomies. I haven't really heard much medical assistants work into this field, but this one's a lot more rare as well too. The last one I'm gonna leave you guys with is pain management. Pain management is definitely different. With pain management, basically this one, it just involves as far as for helping assist, you know, elderly patients that's in pain. For the most part, we do the best that we can as far as for the patient, but you do hear a lot of complaining into this field because a lot of people do be in pain. I wouldn't say complaining in a bad way. Sometimes you can complain in a good way as well too, but you will be working with a physician and you'll just help assist as far as for trigger point injections, anything dealing with the lumbar, because it's a lot of pain that deals with the back, anything dealing with the neck as well too. You'll also be able to educate the patient as far as for exercises to do to try to help strengthen their strength, but and muscles and whatnot. But yeah, this is the list as far as for the top 2021 medical assistant specialties to work with, you guys. If this is something you're looking to get into, I would definitely start now and just start, you know, researching the certain ones that you want to do. You just never know if you may like it or not. Hopefully this works out best for you guys. If this is something you're looking forward to doing, comment down below and let me know which specialty you're looking to work into. Hopefully this be great for you. Don't forget to like, comment, subscribe, and y'all make sure y'all stay safe. Peace.